Build, build, build is the mantra.
That's right. The Prime Minister's setting out some of the plans that we've got to bounce forward, as he's putting it, to make sure that in response to the terrible economic consequences of this virus, that we can really get the country back on our feet as much as possible. And that includes investment going in right now into hospitals, into schools, and getting going with some of those long-standing road building projects that have been really necessary in some parts of the country. And really, it's about an approach, which is the approach that we were elected on just 6 months ago, of levelling up the country, because we want the economic recovery that after this crisis to be one where the economy is stronger and we deal with some of the long-standing British problems like underinvestment. And so he's getting going on that right now, and I'm very glad that a significant proportion of the extra funding will be going into accelerating our hospital building project.
Is it possible, though, that we can set aside the somewhat spurious comparisons to FDR and his New Deal? We're talking about £5 billion of spending, much of which has already been announced. I mean, the New Deal cost $650 billion. You know, despite what the Prime Minister is going to be saying later on, it doesn't sound particularly Rooseveltian to me. It doesn't sound like a New Deal.
Oh, I totally disagree. It's about a direction, an attitude, and of course the immediate funding we can get it underway with. You know, there is a big economic cost to this crisis. That's obvious, and the argument that the Prime Minister has been making and will be making in Dudley is that you've got to build your way out of that, and you've got to deal with some of the long-standing underlying problems like of underinvestment that have long dogged the British economy and the way that we live. So making sure that we, for instance, deliver on the health infrastructure that I'm responsible for building, that we deliver on the transport infrastructure. This is the agenda on which we were elected, and it's £5 billion, but it's also a very clear direction of travel that we're going to put that investment in, and especially to the parts of the country that just haven't had the investment and the growth over the past generations. Actually, this isn't about recent times; it's about generation.
Let's turn our attention then to Leicester. Yesterday, in your statement to the Commons, it was all about recommending. We're recommending nothing but essential travel, recommending staying at home. At what point will the government compel people? How will this be enforced?
Well, we will be bringing forward a legal change very shortly in the next couple of days, because some of the measures that we've unfortunately had to take in Leicester will require a legal underpinning.
So then it's going to be enforced by the police, is it?
Yes, in some cases. So on the question of shops being open, we'll be making the legal change so that non-essential retail is no longer open, and clearly, directly, we will communicate with the schools, because schools unfortunately are going to have to close from Thursday. We are recommending that people stay at home when they can. But
again, just on that point, we have precious little time this morning, I'm afraid, Minister. How will that be enforced? The 6th of June, plenty of places not that far away from Leicester, pubs will be reopening. What is to stop people from Leicester, driving down the roads to Coventry, Sutton Coldfield, Loughborough, Derby, Nottingham? Actually, if you put your foot down, Barnard Castle's just 2.5 hours up the road.
Well, we're recommending against all but essential travel, both to and from and within Leicester. And as we saw during the peak, the vast majority of people will abide by these rules. Now, of course, we'll take further action, including putting in place laws if that's necessary. But I very much hope that it won't be. This is a local lockdown to deal with a very specific problem in Leicester. I set out yesterday that, unfortunately, the number of cases in Leicester is around 3 times higher per head of population than the next highest place. So I think my heart goes out to the people of Leicester. Everybody was really looking forward to the opening up that's due to take place and will take place with the rest of the country on Saturday. But unfortunately,
But
this is necessary.
the problem is, Mr. Hancock, the problem is this, that actually there doesn't appear to have been an awful lot of common sense on display, and you're asking people to rely on their common sense. I mean, the beaches of Brighton and Bournemouth, how many illegal raves have we seen? Brixton, Clapham Common, Tootingbeck Common, Streatham Common, Notting Hill, Maida Vale, Manchester, Oldham. Look at what the Liverpool fans did. I mean, you're asking people to use their common sense when there is plenty of evidence that suggests people aren't.
Well, it's easy to look at the exceptions. The vast majority of people are doing the right thing, and I'm grateful for them. I applaud them, and it's in everybody's interest that we do so. And of course, we're prepared to take action where that is necessary. That's what we've said all along in terms of local action. And last night we had to take that decision in Leicester.
This is the whack-a-mole strategy that the Prime Minister with straight face described this as yesterday. I mean, it has been a couple of years since I saw Boris Johnson down the arcades in Blackpool. But whack-a-mole isn't a strategy. It's entirely reactive. You're quashing an infection after we see the R number rise. I mean, it's almost a better analogy, isn't it, from the way that the government has been behaving over the past few weeks. COVID-19 in care homes pops up, we'll deal with that. PPE not getting to the front line, we'll deal with that. It's not a strategy. When are we going to start getting proactive on this?
No, I think the way that you put it is actually exactly the opposite of the case, because the strategy is to allow for the opening up of the rest of the country, to giving people their freedoms back where it's safe to do so. We also need, alongside that, to take local action where there's a specific flare-up. So we watch the data.
The analogy doesn't even work on that basis. The analogy doesn't even work on that basis, because in whack-a-mole, a mole pops up and you hit it. It's been 11 days since we knew that there was a situation in Leicester.
Well, I'll just finish my answer. The whole point is that you watch the data, and then when you see a problem arising, then you immediately take action. That's what we've done in Leicester. We've done it also in Keighley, for instance. The Welsh government have done it in North Wales, in Wrexham, in Anglesey. We've done it in Weston-super-Mare. Now, if further action's then needed, for instance, what we did in Leicester last night, then of course we're willing to take it. But yes, we're taking action rapidly in outbreaks where we see them right across the country. In some cases, it's, for instance, closing 2 GP surgeries in Enfield, so a very small targeted action. But if the outbreak continues, as it has done in Leicester, even despite the fact that we've been engaged in almost 24 different workplaces where there's a problem, some of the schools were closed last week. We've been taking action. We've put in those extra mobile testing units. There comes a point when you have to take broader action, and that's what we've done.
Can we talk briefly about the schools and indeed the situation with the children in Leicester? A number of parents, myself included, our ears perked up yesterday when you mentioned the impact that this was having on children, not on their health, but indeed on their role in transmission of COVID-19. I'm just wondering whether or not we have an R number for school-age people in Leicester and why we're not closing the schools today.
You can't get an R number that is that localized. What you have to do is look for individual cases, and in the very significant testing that we brought into Leicester with those mobile testing units, we have seen a number of positive cases in the under 18s, and that's why we took the decision, with a heavy heart, it has to be said, to close schools in Leicester and in Leicestershire within the Leicester conurbation. And so, there is the good news is, it's really important to stress this for people watching, not only in Leicester but across the country, is that the risk to children themselves is very, very low. It's one of the saving graces of this virus. But of course, children can still transmit.
Just one question, Mr. Hancock. I know it's slightly off your brief. What about financial assistance targeted to Leicester and perhaps other parts of the country that might be entering local lockdown? I mean, what happens if you can't work, if the schools are closed? Some of the financial assistance that the government has provided is beginning to come to an end this week, and we're looking at 2 weeks at least of lockdown in Leicester.
Well, look, it's a really important question. The furlough scheme remains and is there. but we've also put in money to the local councils so that on a discretionary basis they can use that to support people who need further support. That's both for communications, but also if there's specific instances. It's far better that's done by the council on the ground, responding very locally to different concerns. So it's a really important consideration. You say it's off my brief. It's not really, because you've got to look after. You've got to support people as best we can through what is a very difficult decision.